And so, you know, when we look at how the behavioral and various workforce shortages impact people, I think it's so important to see how all the things are interconnected. And I have to be aware that I'll stop there.
I'm not sure I can say any better than that. Doc's exactly 100% correct on that. It's your rural areas in West Virginia that get affected the most, the quickest, just because we're already shorthanded in rural. And if you look at West Virginia as a whole, we're such a diverse state. And no matter which part of the state you go to, you're going to find something different. Regionally, it's just, it's beautiful and it's amazing to go, especially when it comes to EMS. So when we talk about what Doc was saying when it comes to how it affects the communities, the difference between 3 ambulances in a small county and 2 ambulances in a small county means an hour to get to you instead of 30 minutes of getting to you. So it's just that one truck that can make a huge difference in those rural areas. But other than that, I think you did set it perfect.
Yeah, I think speaking in my specific area, which I'm from Martinsburg, and you can't get there from here. But you know, we're certainly not a laid-back community. We're very active in our community. We have a lot of community partnerships, and if we look back 10 years, you know, we were in a situation where we're looking at how do we build better stakeholder relationships. What else can we offer our community? Where do we go from here? You know, looking for things to do to enhance the services that we provide. Now we move to current day, and we're looking at all the shortages that we're experiencing. You know, making sure that we have enough paramedics to even staff equipment for that day. All of those things we were trying to do 10 years ago obviously take a back seat. And if we're looking at how this intermingles with behavioral health, one of the things that we were really impactful with was, as Jan said, quick response teams and getting that up and off its feet. But now that's just one example of a service that had to be backed up and say, we don't have the staff to do this at this point in time. Because quite frankly, we're a 911 service, and that has to take priority over everything. So we make sure we can cover the 911 response for that day, but all of those other things had to be put on the back burner and still remain on the back burner until we can get our staffing levels back to where they should be.
Great, and I agree with everything that everyone has said so far. But so the West Virginia Behavioral Healthcare Providers Association, we're a small shop, but like I said, I've been there for 11 years. I appreciate Carolyn defining behavioral health in its broad terms, because it is broad, the different areas that we cover. And so we have a little less than 30 members, and those 30 members employ about 7,700 people across the state of West Virginia. And that's a lot. However, 10 years ago, it was 14,000 individuals in West Virginia. And so there's a lot of different ways to look at that. A lot of the things that you know, what does the workforce shortage cause problems with? Well, wait times. You know, how quick can you get in to see someone? You know, what's the access to the various levels of care that you can get? And I think people have talked about it before here too, and we represent a large IDD population. So in severe and persistently mentally ill population that require 24-hour care. And so that's a really staff-intensive services that we offer. And I was at a meeting on Sunday at the Capitol where the question was, what are we going to do about violent IDD individuals in residential care that are injuring staff, other people, and people in the community? And you know, how do we identify those people that are violent? What would we do with those people that are violent? And one of the things that I told them was, they might be violent because of the workforce shortage that we have. Because when they used to have 3 or 4 people that got to watch them in the home, if they wanted to go on a date, or they wanted to go to the movies, or they wanted to go to church, or they wanted to do whatever they wanted to do, can't do that now. And we hear that more and more and more often. And that happens in the mental health situation as well as the IDD situation. And so then you have a situation where you've got less people that the workers there can depend on, and then they start to drop off. And so it's a snowball thing.
It sounds like you're all seeing the impact of the shortages in your different roles that you work in. So I want to talk a little bit about the pipeline specifically. Jan mentioned in her keynote, and Cynthia alluded to it too, that we have really, especially over the past 10 years, but longer than that, seen EMS and behavioral health systems really forced to work together more closely to meet community needs. And so how can you envision these relationships, whether that's building from QRTs in your communities or the other work that you're doing, how can you see these relationships benefiting recruitment, if at all, and strengthening the education piece for EMS or behavioral health? And we can start again with Marianna if you're open to that.
I'm trying to think of where that's an interesting question. So are we wondering how different initiatives out in the community might affect the pipeline, or how we could think about the pipeline in relationship to those? You know, I think as I was listening to that question, it made me think about a lot of things. And one is, like Jan mentioned, we got to visit each other's spaces. We got to know what we're doing, and you know, integrate more. For example, behavioral health into different kinds of training, like the mental health first aid, and you know, we need to be more educated about what a first responder can and can't do in those situations, and how we can be of help. And I think when I think about the pipeline piece, I do think there's a disconnect somewhere, particularly, I'll just speak with behavioral health, between sort of the public education system and us. I don't think that the average you know, high school student, or particularly middle school student, knows about all of the options in behavioral health. They know that there are people out there that work with people with problems. Maybe they've had some experience, but I think as far as knowing what the vast, you know, majority of the options are out there and how to get there, I think there's a real disconnect. And I think some of that could be addressed by us as professionals being more involved and getting more information out there about what we do. And I think we do need more initiatives like, you know, the QRTs. And I know we've been talking in Cabell County about even mobile mental health units that respond not just to crisis, but we have a lot of people with severe mental illness who are not stably housed, who are out in communities, and we need relationships with them before the crisis comes. And I think that's really key in our rural communities too, for both behavioral health and other first responders. You know, we need those relationships. And when our workforce is low, we don't have enough, it's hard to get out and build those relationships and have those opportunities, you know, to visit and for people to become more familiar with what we do. So I think those initiatives that sort of bring us all together are really important in getting that out there. And I don't know if I addressed some of that. But
Mark, do you want to add anything from a behavioral health perspective?
Well, I think Dr. Linz mentioned mental health first aid, and that might be a training that, you know, should be, you know, something that we can connect with all EMS workers, so we can know what you're doing when you go out and approach somebody that may have a mental health condition. So, you know, that's one way. The other thing that you said was getting into middle schools and high schools, and I'm as guilty as everybody because I have other pressing things to do, but all of us need to be banging down the doors of our public education system and going in and telling, you know, kids today, hey, we need you. We need you to come and work in this industry, and let me tell you about it.